University of Southern California and the LA County Public Health put out a report today that suggests that the penetrance of the virus is as much as almost 40 times what it was believed to be, that as many as 442,000 people in LA County may have been infected, which suggests two things. It suggests that you have a lot more people out there who could be spreading the virus, but it also suggests that the case fatality rate is more in line with the 2017-2018 flu than what we've seen in some other areas of the world. I'm wondering if you've seen that, what your thoughts were.
So we're looking at all those studies very carefully, and I think you will remember over the last 3 weeks I've been talking about the level of asymptomatic spread and my concern about asymptomatic spread, because with flu and other diseases, when people are sick, it's easy to contact trace. When people are not sick and shedding virus, you have to have a very different approach. Younger age groups may have more asymptomatic disease, and your asymptomatic disease may decrease with your older age groups, and that your symptomatic disease might increase with age groups. This is still our working hypothesis. We have no data right now still to support that, and we're really asking people to start testing in among the first responders and the healthcare workers that may have had the greatest exposure, because that's where the test will be most reliable. And then when we have the luxury, we can go out to broader and broader communities. But this has been the fundamental question to begin with, and has been persistent, and we will emphasize to the American people again, this is a highly contagious virus. And we don't know by looking at someone whether they have pre-existing conditions or not. And so all of us, as far as protecting others, must continue to do all of the recommendations to ensure that when we are in an asymptomatic state, we're not passing the virus to others.
She absolutely did not ask the question. In fact, completely diverted it and said this has been the essential question from the beginning. How many asymptomatic carriers? How can we get the testing done? Testing. How can we keep surveillance on you? Can we break this down for a second? The question was, we now have studies happening all over the country that show that the death rate of the coronavirus, because it looks like a much higher number of people infected, between 220 to 440,000 people, then that brings down the death rate. If the death rate is like the flu, what do you have to say about that? Why are we locked down? She does not address the death rate at all. Instead goes on to a giant tirade about asymptomatic carriers.